BLS Exam 2026 AHA 40 Important Questions Part 2. Question 1. You are preparing to apply AED pads to a victim whose chest is covered in thick hair. The AED prompts, check pads. What should you do? Option A, press the pads down as hard as possible. Option B, use the razor included in the AED kit to shave the area, then apply new pads. Option C, apply the pads over the victim's clothing instead. Option D, do not use the AED and continue CPR. The correct answer is option B. Use the razor included in the AED kit to shave the area, then apply new pads. Thick chest hair can prevent the AED pads from sticking to the skin, causing a poor connection. You must quickly shave the areas where the pads will be placed using the razor provided in the AED kit. Question 2. You notice the victim has an implanted pacemaker or defibrillator, a hard lump under the skin on the upper chest. Where should you place the AED pad? Option A, directly over the implanted device. Option B, avoid placing the pad directly over the device, place it slightly below or to the side. Option C, do not use the AED, wait for EMS. Option D, place both pads on the victim's back. The correct answer is option B. Avoid placing the pad directly over the device, place it slightly below or to the side. Placing an AED pad directly over an implanted medical device can block the shock to the heart. You should place the pad an inch or two away from the device. Question 3. If you are assessing a victim and checking for a pulse for 10 seconds, but you are not sure if you feel a pulse, what is your next step? Option A, wait another 10 seconds to be absolutely sure. Option B, give 2 rescue breaths and check again. Option C, immediately begin chest compressions. Option D, place the victim in the recovery position. The correct answer is option C, immediately begin chest compressions. If you do not definitely feel a pulse within 10 seconds, do not waste time. You must assume there is no pulse and immediately begin high-quality chest compressions. Question 4. What is the preferred method for opening the airway of a victim with a suspected head, neck, or spinal injury? Option A, head tilt chin lift. Option B, blind finger sweep. Option C, jaw thrust maneuver. Option D, neck extension. The correct answer is option C, jaw thrust maneuver. The jaw thrust maneuver is used for victims with suspected spinal injuries because it opens the airway without moving the neck or cervical spine. Question 5. If you attempt the jaw thrust maneuver on a victim with a suspected spinal injury and the airway does not open, what should you do next? Option A, do not give rescue breaths. Option B, perform the head tilt chin lift maneuver. Option C, perform abdominal thrusts. Option D, attempt mouth-to-nose ventilation without opening the airway. The correct answer is option B, perform the head tilt chin lift maneuver. Maintaining an open airway and providing breathing is a matter of life and death. If the jaw thrust does not open the airway, you must use the head tilt chin lift, as securing the airway is the highest priority. Question 6. You witness an adult suddenly collapse. You are alone and do not have a mobile phone. What is your first action after verifying the scene is safe and the victim is unresponsive? Option A, leave the victim to activate the emergency response system and get an AED, then return to begin CPR. Option B, perform CPR for 2 minutes, then leave to get help. Option C, provide 2 rescue breaths, then check for a pulse. Option D, place the victim in the recovery position and wait for someone to walk by. The correct answer is option A, leave the victim to activate the emergency response system and get an AED, then return to begin CPR. For a sudden, witnessed adult collapse, the cause is most likely an initial cardiac arrhythmia. You must leave the victim to call 911 and get an AED immediately, then return to start CPR. Question 7. You find an unresponsive child, unwitnessed collapse. You are alone and do not have a phone. What is your sequence of action? Option A, leave the child immediately to get an AED. Option B, perform high-quality CPR for 2 minutes, about 5 cycles, then leave to activate the emergency response system and get an AED. Option C, wait for a bystander to help before starting CPR. Option D, only perform rescue breaths until EMS arrives. The correct answer is option B, perform high-quality CPR for 2 minutes, about 5 cycles, then leave to activate the emergency response system and get an AED. For an unwitnessed pediatric collapse, the cause is likely asphyxial, respiratory. Performing 2 minutes of CPR provides critical oxygen to the brain before you leave to activate the emergency response system. Question 8. How do you check for responsiveness in an infant? Option A, shake the infant gently by the shoulders. Option B, tap the bottom of the infant's foot and shout. Option C, yell loudly into the infant's ear. Option D, splash a small amount of cold water on their face. The correct answer is option B, tap the bottom of the infant's foot and shout. To check responsiveness in an infant, you should tap the bottom of their foot firmly and shout to see if they react, cry, or move. Question 9. A choking victim is pregnant or heavily obese. You cannot wrap your arms fully around their abdomen. What modification should you make to relieve the obstruction? Option A, perform abdominal thrusts anyway, just lower down. Option B, perform chest thrusts instead of abdominal thrusts. Option C, have them bend over and perform only back slaps. Option D, do not attempt to clear the airway, wait for EMS. The correct answer is option B, perform chest thrusts instead of abdominal thrusts. For a pregnant or heavily obese choking victim, you should wrap your arms under the victim's armpits and perform inward chest thrusts over the lower half of the breastbone instead of abdominal thrusts. Question 10. What is the most common cause of gastric inflation, air entering the stomach, during CPR? Option A, using an AED too early. Option B, giving rescue breaths too rapidly or with too much volume. Option C, compressing the chest too deeply. Option D, not clearing the airway of vomit. The correct answer is option B, giving rescue breaths too rapidly or with too much volume. Gastric inflation happens when air is forced into the stomach instead of the lungs. This is usually caused by giving breaths too quickly, too forcefully, or delivering too much volume. Question 11. You arrive on the scene with an AED. The first rescuer is already performing chest compressions. What is your role as the second rescuer? Option A, tell the first rescuer to stop compressions so you can set up the AED. Option B, take over compressions immediately while the first rescuer sets up the AED. Option C, turn on the AED and apply the pads while the first rescuer continues compressions. Option D, wait until the first rescuer finishes 5 cycles of CPR before turning on the AED. The correct answer is option C, turn on the AED and apply the pads while the first rescuer continues compressions. To minimize interruptions, the second rescuer should immediately turn on the AED and attach the pads around the first rescuer's hands while they continue chest compressions. Question 12. If a victim is lying in a small puddle of water or snow, is it safe to use the AED? Option A, no, you must move them indoors first. Option B, no, water and AEDs always cause shock to the rescuer. Option C, yes, as long as the victim's chest is wiped dry, they do not need to be completely dry or moved from a small puddle. Option D, yes, you can place the pads directly on the wet chest. The correct answer is option C, yes, as long as the victim's chest is wiped dry, they do not need to be completely dry or moved from a small puddle. It is safe to use an AED if the victim is lying in snow or a small puddle. The key is to wipe the chest dry so the shock travels through the heart and not across the water on the skin. Question 13. You are using an AED on an infant, but you only have adult AED pads available. What should you do? Option A, do not use the AED. Option B, cut the adult pads in half to fit the infant. Option C, use the adult pads, placing one on the center of the chest and one on the center of the back so they do not touch. Option D, place both pads on the front of the chest, even if they overlap. The correct answer is option C, use the adult pads, placing one on the center of the chest and one on the center of the back so they do not touch. If pediatric pads are unavailable, you may use adult pads on an infant or child. To prevent them from touching, use an anterior-posterior, front and back, placement. Question 14. You are treating an adult victim in cardiac arrest, but the AED only has pediatric pads. What should you do? Option A, use the pediatric pads on the adult. Option B, do not use the pediatric pads, continue high-quality CPR instead. Option C, place the pediatric pads on the adult's back. Option D, cut the pads to make them larger. The correct answer is option B, do not use the pediatric pads, continue high-quality CPR instead. Pediatric pads deliver a lower dose of energy, attenuated shock, that is insufficient to defibrillate an adult heart. You should not use pediatric pads on an adult, continue CPR. Question 15. Which of the following is the first link in the AHA adult out-of-hospital chain of survival? Option A, high-quality CPR. Option B, early defibrillation. Option C, activation of the emergency response system. Option D, advanced resuscitation by EMS. The correct answer is option C, Activation of the emergency response system. The first link for an adult in an out-of-hospital setting is the immediate recognition of cardiac arrest and activation of the emergency response system, calling 911. Question 16. Which of the following is the first link in the AHA pediatric chain of survival? Option A, immediate high-quality CPR. Option B, rapid defibrillation. Option C, prevention of cardiac arrest. Option D, advanced life support. The correct answer is option C, prevention of cardiac arrest. Because pediatric cardiac arrest is usually the result of preventable injuries or respiratory failure, the first link in the pediatric chain of survival is the prevention of these causes. Question 17. During a team resuscitation, the team leader assigns you the role of airway. You realize you have never used a bag mask device before. What is the most appropriate action? Option A, try to figure it out as you go. Option B, refuse to participate and walk away. Option C, ask the team leader for a different role, stating your limitation. Option D, pretend to use it without actually giving breaths. The correct answer is option C, ask the team leader for a different role, stating your limitation. A core principle of team dynamics is knowing your limitations. You must immediately inform the team leader if you are assigned a task you are not fully trained or comfortable performing. Question 18. The AED analyzes the rhythm and prompts, no shock advised. What is your very next step? Option A, check for a pulse. Option B, wait for the AED to analyze again in 2 minutes. Option C, give 2 rescue breaths. Option D, immediately resume high-quality CPR, starting with chest compressions. The correct answer is option D, immediately resume high-quality CPR, starting with chest compressions. If the AED advises no shock, it means the heart is not in a shockable rhythm. You must immediately resume CPR, starting with chest compressions, to keep blood flowing. Question 19. What is the target, chest compression fraction, CCF, recommended by the AHA to maximize survival outcomes? Option A, at least 40%. Option B, at least 60%, but ideally greater than 80%. Option C, exactly 50%. Option D, 100%, no breaths given. The correct answer is option B, at least 60%, but ideally greater than 80%. CCF is the proportion of time during cardiac arrest resuscitation that chest compressions are being performed. The AHA recommends a CCF of at least 60%, aiming for 80% or higher. Question 20. Why is it important to ensure a victim is lying on a firm, flat surface before starting CPR? Option A, to make it easier to attach the AED pads. Option B, to keep the victim's airway open naturally. Option C, so the chest compressions effectively squeeze the heart between the sternum and the spine. Option D, to prevent the rescuer's knees from hurting. The correct answer is option C, so the chest compressions effectively squeeze the heart between the sternum and the spine. If the surface is soft, like a bed, pushing down will just push the victim into the mattress. A firm, flat surface ensures the compressions actually squeeze the heart to pump blood. Question 21. You are giving mouth-to-mouth breaths to an adult victim. What is the correct technique? Option A, pinch the victim's nose closed, seal your mouth over theirs, and give a breath that makes the chest rise. Option B, leave the nose open so air can escape. Option C, blow as hard as you can into the mouth. Option D, give 5 quick breaths in a row. The correct answer is option A, pinch the victim's nose closed, seal your mouth over theirs, and give a breath that makes the chest rise. For mouth-to-mouth, use the head tilt chin lift to open the airway, pinch the nose closed, create an airtight seal over the victim's mouth, and deliver a breath over 1 second, watching for chest rise. Question 22. A 65-year-old man clutches his chest, complains of crushing chest pain radiating to his left arm, and is sweating profusely. He is awake and breathing. What is he likely experiencing? Option A, cardiac arrest. Option B, a severe stroke. Option C, a heart attack, myocardial infarction. Option D, a seizure. The correct answer is option C, a heart attack, myocardial infarction. A heart attack occurs when blood flow to part of the heart muscle is blocked. The victim is usually awake and breathing, unlike sudden cardiac arrest, where the heart stops completely and the victim is unresponsive. Question 23. If an adult victim has a suspected opioid overdose, has a pulse, but is breathing abnormally, or not at all, what is the correct care? Option A, start chest compressions immediately. Option B, provide rescue breathing, 1 breath every 6 seconds, and administer naloxone if available. Option C, perform the Heimlich maneuver. Option D, give the victim a glass of water. The correct answer is option B, provide rescue breathing, 1 breath every 6 seconds, and administer naloxone if available. Because the victim has a pulse, they are not in cardiac arrest, but they are in respiratory arrest. Provide rescue breathing and administer the opioid reversal drug naloxone. Question 24. You find a victim who is unresponsive, has no normal breathing, and no pulse. You suspect an opioid overdose. What should you do first? Option A, wait for naloxone to arrive before doing anything. Option B, start CPR immediately and use an AED, give naloxone when it arrives without delaying CPR. Option C, give naloxone, wait 5 minutes, then start CPR. Option D, only perform rescue breathing. The correct answer is option B, start CPR immediately and use an AED, give naloxone when it arrives without delaying CPR. Cardiac arrest protocols take precedence. If there is no pulse, you must start CPR and use an AED immediately. Do not delay chest compressions to administer naloxone. Question 25. A colleague is performing CPR, but you notice they are only compressing the chest about 1 inch deep. What is the best way to handle this using good team dynamics? Option A, push them out of the way and take over. Option B, yell at them for doing it wrong. Option C, provide constructive intervention by politely saying, make sure you push at least 2 inches deep. Option D, wait until the resuscitation is over to tell them. The correct answer is option C, provide constructive intervention by politely saying, make sure you push at least 2 inches deep. Constructive intervention involves correcting a team member professionally and immediately if they are making a mistake that compromises patient care. Question 26. What is the correct hand placement for performing high-quality chest compressions on an adult? Option A, on the upper half of the breastbone. Option B, on the lower half of the breastbone, sternum. Option C, directly over the heart on the left side of the chest. Option D, on the abdomen, just above the navel. The correct answer is option B, on the lower half of the breastbone, sternum. The correct hand placement for an adult is the heel of one hand on the lower half of the breastbone, sternum, with the other hand placed on top. Question 27. When should you use a pocket mask instead of a bag mask device? Option A, when there are 2 or more rescuers. Option B, when you are a single rescuer performing CPR. Option C, when the victim is an infant. Option D, you should never use a pocket mask. The correct answer is option B, when you are a single rescuer performing CPR. A pocket mask is best suited for one rescuer CPR because it is easy to transition from compressions to breaths. A bag mask device requires 2 hands to form a good seal and is best used in 2 rescuer CPR. Question 28. When performing 2 rescuer CPR, the compressor should pause compressions to allow the ventilator to give breaths. True or false? Option A, true, unless the victim has an advanced airway in place. Option B, false, compressions should never stop for any reason. Option C, false, the ventilator gives breaths while the compressor is pushing. Option D, true, even if an advanced airway is in place. The correct answer is option A, true, unless the victim has an advanced airway in place. During standard 30:2 CPR, the compressor pauses so the ventilator can give 2 breaths. However, if an advanced airway, like an ET tube, is in place, compressions are continuous without pauses for breaths. Question 29. What does the term clear roles and responsibilities mean in team dynamics? Option A, everyone does every job to share the workload. Option B, the team leader does all the work. Option C, every team member knows exactly what their specific job is, example, compressor, AED operator, airway, during the resuscitation attempt. Option D, only doctors have roles, others watch. The correct answer is option C, every team member knows exactly what their specific job is, example, compressor, AED operator, airway, during the resuscitation attempt. Assigning specific roles avoids confusion and ensures that all necessary tasks, compressions, airway management, AED use, medications, are performed efficiently without overlap or neglect. Question 30. Which action demonstrates closed-loop communication? Option A, the team leader gives an order and the team member nods. Option B, the team member guesses what medication to give. Option C, the team leader says, give 1 mg of epinephrine. The team member says, epinephrine 1 mg is in, after administering it. Option D. Everyone talks at the same time. The correct answer is option C. The team leader says, give 1 mg of epinephrine. The team member says, epinephrine 1 mg is in, after administering it. Closed-loop communication requires the sender to give a clear message, the receiver to repeat it back to confirm understanding, and to announce when the task is completed. Question 31. You are giving rescue breaths to a victim with a stoma, a surgical opening in the neck. How do you ventilate? Option A. Cover the stoma and breathe into the mouth. Option B. Breathe directly into the stoma using a pediatric or standard pocket mask. Option C. Ignore the stoma and use the bag mask on the face. Option D. Do not give rescue breaths to a victim with a stoma. The correct answer is option B. Breathe directly into the stoma using a pediatric or standard pocket mask. For a victim with a tracheostomy or stoma, you must provide rescue breaths by placing the mask directly over the stoma on their neck, creating an airtight seal. Question 32. How does the presence of an advanced airway change the roles of the two rescuers? Option A. One rescuer leaves to get more help. Option B. The compressor gives 100 to 120 compressions per minute continuously, and the ventilator gives one breath every 6 seconds without pausing compressions. Option C. The ratio changes to 15 to 2. Option D. They switch roles every 5 minutes instead of 2 minutes. The correct answer is option B. The compressor gives 100 to 120 compressions per minute continuously, and the ventilator gives one breath every 6 seconds without pausing compressions. Once an advanced airway is placed, the rescuers no longer use the 30 to 2 ratio. Compressions become continuous, and breaths are given independently every 6 seconds. Question 33. While performing chest compressions on an adult, you hear a cracking sound. What should you do? Option A. Stop compressions immediately and check for broken ribs. Option B. Switch to rescue breaths only. Option C. Pause and move your hands to the left side of the chest. Option D. Ensure your hand placement is correct and continue high-quality chest compressions. The correct answer is option D. Ensure your hand placement is correct and continue high-quality chest compressions. Rib fractures can occur during high-quality CPR. While you should verify your hand placement is correct, lower half of the sternum, you must continue compressions because stopping will lead to the victim's death. Question 34. Which characteristic is not a component of high-quality CPR? Option A. Compressing at a depth of at least 2 inches, adults. Option B. Allowing complete chest recoil. Option C. Compressing at a rate of 80 to 90 per minute. Option D. Minimizing interruptions to less than 10 seconds. The correct answer is option C. Compressing at a rate of 80 to 90 per minute. A rate of 80 to 90 compressions per minute is too slow. High-quality CPR requires a compression rate of 100 to 120 compressions per minute. Question 35. What is the maximum time you should spend trying to find a pulse on an unresponsive victim? Option A. 5 seconds. Option B. 10 seconds. Option C. 15 seconds. Option D. 30 seconds. The correct answer is option B. 10 seconds. You should spend no less than 5 seconds and no more than 10 seconds checking for a pulse to minimize the delay in starting chest compressions. Question 36. You are working in a team, and the team leader asks you to perform a task you know is outside AHA guidelines. What is the appropriate team dynamics response? Option A. Perform the task anyway because they are the leader. Option B. Quietly step away from the team. Option C. Respectfully question the order and suggest the correct guideline action. Option D. Yell at the leader in front of the team. The correct answer is option C. Respectfully question the order and suggest the correct guideline action. Knowledge sharing and constructive intervention mean that if a team member observes an action that may harm the patient or violates guidelines, they should respectfully address it with the team leader. Question 37. When should you activate the emergency response system if you are alone with an unresponsive infant who has an unwitnessed collapse? Option A. Immediately, before doing anything else. Option B. After performing 5 cycles, about 2 minutes, of CPR. Option C. After 10 minutes of CPR. Option D. Never. Drive them to the hospital yourself. The correct answer is option B. After performing 5 cycles, about 2 minutes, of CPR. For an unwitnessed infant collapse, a lone rescuer should provide 2 minutes of high-quality CPR first, to provide critical oxygenation, before leaving the infant to call EMS. Question 38. If a child has a heart rate of 75 beats per minute but is not breathing normally, what action should you take? Option A. Start chest compressions. Option B. Give rescue breaths at a rate of 1 breath every 2 to 3 seconds. Option C. Use the AED to deliver a shock. Option D. Place them in the recovery position. The correct answer is option B. Give rescue breaths at a rate of 1 breath every 2 to 3 seconds. If the pulse is greater than 60/min but breathing is absent or abnormal, you only need to provide rescue breathing. Do not start compressions unless the pulse drops below 60/min with signs of poor perfusion. Question 39. What is the primary purpose of an AED? Option A. To restart a heart that has flatlined, asystole. Option B. To analyze the heart rhythm and deliver an electrical shock to restore a normal rhythm in cases of ventricular fibrillation, VF, or pulseless ventricular tachycardia, private. Option C. To measure the victim's blood pressure. Option D. To provide artificial respiration. The correct answer is option B. To analyze the heart rhythm and deliver an electrical shock to restore a normal rhythm in cases of ventricular fibrillation, VF, or pulseless ventricular tachycardia, private. An AED does not restart a stopped heart, asystole. It stops a chaotic, quivering heart rhythm, fibrillation, allowing the heart's natural pacemaker to reset and resume a normal rhythm. Question 40. During infant CPR, if you are a single rescuer, which compression technique is recommended? Option A. 2 fingers in the center of the chest, just below the nipple line. Option B. Heel of one hand. Option C. 2 thumb encircling hands technique. Option D. Full 2-hand adult technique. The correct answer is option A. 2 fingers in the center of the chest, just below the nipple line. For a single rescuer performing infant CPR, the standard is the 2-finger technique. Note, AHA 2020 guidelines also permit the 2 thumb encircling hands technique for single rescuers, but the 2-finger method is traditionally tested as the 1 rescuer primary method.